your patient is dead. That's the only thing they wrote in the message. And it says, your patient is dead. I'm like, what?
What is like the worst page you ever got in residency?
Oh, that's a good. Oh, I remember. I know exactly the page.
I was like, we all have that one page.
I have this one. So I was cross covering. I think I was a second year resident, and I was covering like vascular, and I was in the ICU and gen surge and all this stuff. And I get this, and I had gotten sign out from all the services, right? They all go home at 6 p.m. So I'm there in the hospital, and I get this page, and it's a nurse on whatever floor, 8100 or something. She says, your patient is dead. That's the only thing they wrote in the message on the thing. And it says, your patient is dead. I'm like, what? I'm like, no one, this is the first time hearing. I heard no code. I'm like, what the heck? So I run up to the unit. I go up in there. I go in the room. The patient's dead. I don't know who this patient is because, she's like on different service. I hadn't gotten signed out about this patient. Patient totally dead, cold body. And so I go grab the nurse. I'm like, you guys can call code. They're like, oh, no, we were expecting her to pass away. This wasn't anything, like we were expecting it. Like she was, kind of end of care type thing. They were just kind of waiting for her to die. She's like, I was just messaging you to tell you that the patient finally passed. I'm like, thank you, but I had no idea. Like maybe next time,
a little better on the sign out, maybe from the other team
sign
as well.
Out, and then maybe like a little less of aggressive message. But oh my gosh, so I had to do the declaration time of death and all that stuff to document it. But that was probably the worst one I got because I did not expect that at all.
Yeah, I was like, that's not the page that you want in the middle of the night. That'll wake you up quick. Yeah, better than a cup of coffee.
How about you, Sean? What's your memorable page?
So I was a senior, like chief resident at the university on plastics. We have a team of like 3 or 4 residents at the time, and I get a page at like, I think it was like 2 a.m. It was like middle of the night, and I was at home. I wasn't even like in house at the time, and the page that I got was severed arm in the operating room. Like, please advise. It's like nothing else, just like severed arm, like. Just want to let you know that there's a severed limb, so you should probably be involved.
It's on the back table. Can you come look at it?
Yeah, can you come take a peek at it? So I called my 5th year. It was Dr. Melissa Mueller, and we came in, and we literally went in the operating room, and there was an arm, but there's no patient. This is literally an arm.
Wait, what? Just an arm?
Yeah, there's an arm in like literally somebody's arm.
Just an arm.
Just right here, middle of the humerus, just elbow, hand on a table, and Melissa's already there, and she's scrubbed in, and she's kind of marking everything. I was like, I mean,
what are we doing?
We probably need another piece to this puzzle. And apparently,
where's the rest of this?
It was a motorcycle accident, and his severed arm was like number 4 on the list of severity of things that had to be dealt with. So he had already gone with like trauma surgery for like an X-lap to take a look at his belly because he had bleeding, and then he had pelvic bleeding, so they had to send him to IR to get embolized, so and that's where he was. It's like he had left the operating room to go to IR, and they were like, well, if he comes back, then you get a shot at putting the arm back on. But it was like surreal being in an operating room with like the patient. It's like you have some of a patient, but there's no monitors, which was something
that's a little weird.
It's super weird, and it's something that probably other people really wouldn't think about, right? It's like when we're in an operating room and when you're actively operating, there's that cacophony of just beeping and blipping and all the stuff, and we're used to hearing it, and it feels good in a way because it all like makes sense. Like patients alive, patients doing well. So when we're working and like tagging everything on the arm, it's just
quiet,
silent, and it's the middle of the night, so it's like skeleton crew. There's nobody else around, so it's just like silently hanging out in an operating room, like waiting for someone to come back. And of course, when they come back, it comes back with like, there's 12 people, kicking the door. Yeah. There's 1 million people. Everybody's rushing in. It's just like all of a sudden it feels like a true operation again. And we were able to like reimplant his arm. But the initial period of like putting it, just tagging everything, get everything marked out when you're working and it's just silent there. It's just strange. But yeah, that was my worst page. It's my worst page. Severed arm.
That's wild.
Please advise.
There's a big part of me that, because I love upper extremity trauma and hand stuff, and like at USC we did a lot of that type of stuff, and at Loma Linda. But there is an aspect to that, like you kind of mentioned, just that environment. Like I miss it sometimes. I don't miss being up in the middle of the night. I don't miss how long those cases take, but I love the technical aspects of it. Like even just you describing that, I'm just in my head thinking, okay, you got to stabilize, or you got to either shorten the humerus, you got to stabilize the bone. You're gonna have to get all the vessels ready, the nerves. You're gonna have to probably get grafts. You're gonna have to, you maybe put a shunt in the arm, like all these things. And like they just start coming to my head, and it just makes me kind of miss that, and I don't get to do that now as much. At all, actually.
I was going to say not anymore for either of us.